Thank you so much for that and for joining our breakout session here. And we welcome Dr. Martin and everyone here. We're so glad you could join. So I think what we want to do is I'll do a little bit of an introduction to the speakers, but we're very interested in knowing who's in the room and how we can assist and in what ways you are interested in this panel. So, so please put your name and your interest in the chat. And again, we're so glad to have you here. So a quick question for the conference organizers. Do you have the breakout panels been doing a round of introduction, or should we do the panel and then the introductions after? What helps you guys, and what's been the conference kind of way that it's been being organized?
Are you asking about a round of introductions for all the participants in the room?
Yeah.
I don't think we've done those in every session, but I think it might be nice to kick off with those if you'd like.
Okay, so let me do this. I'm going to read some quick bios because, oh, thank you, Jane and all for joining, because I want to make sure that everyone hears the introductions of those people in the room. So let me do a quick round of introductions, and then maybe we'll do it this way. We hope to have a very robust Q&A, and if you could introduce yourself and then ask your question, that will help us learn both who you are, and then we'll also have a great opportunity to link it to the question that you're asking. So welcome everyone to this panel. We are so thrilled to have you here, genuinely thrilled, and nursing is so excited to be a part of this effort. I'm Elizabeth Cohn, and I'm the founder and the director of Nurses Who Vote. I was an Obama White House champion of change for health equity, and Nurses Who Vote is a nonprofit, nonpartisan organization that promotes health at the ballot box. We are genuinely hoping that we can ask nurses across the nation to look at the ballot, to look at voting as an opportunity to think about the health of our nation and the way that we can promote it. Last year, our outreach to nursing schools topped almost 450 voting kits, including a Get Out the Vote civic participation syllabus in nursing and health policy classes, and kits to register 30, 60, or 90 voters at your school or organization. Our kits included stickers that said, "A nurse registered me to vote, and my voice will be heard at the ballot box." So we are thrilled that we can be a part of this organization and this conference today, and lend our voice, our strong voice, to these efforts. It's my pleasure to introduce our panel. Alec Stone is the Oncology Nursing Society's Public Affairs Director. He's been a leader in the legislative and regulatory affairs for more than 2 decades. Mr. Stone has worked with premier organizations such as the American Cancer Association, the American Dental Association, and Research America. As a public policy professional, Mr. Stone has extensive experience with Congress, the NIH, the FDA, the CDC, and other federal agencies. He's created 2 congressional health caucuses and drafted report language, held legislative briefings, and has set up annual meetings between advocates and their federal representatives. He has a master's degree from the Public Administration School at the Southern Illinois University Graduate School of Public Affairs, and he's also a graduate of GW, a alma mater that he shares with one of our other panelists. I also want to introduce Ashley Waddell. She's the Director of Government Affairs and Educational Programs for the Organization of Nurse Leaders of New England Chapter, minus Maine. She's a Senior Fellow at the Center for Health Policy and Media Engagement at George Washington University, and her research and practice interests address how nurses influence and participate in health policy, and how nursing curricula prepares nurses for such work. During the COVID-19 pandemic, Ashley worked with school leaders on nursing and healthcare workforce strategies and led national and regional efforts to align academic practice and addressing new nurses for a transition to practice. She's part of the Jonas Nurse Leader Scholars and served as an AACN faculty policy think tank. And lastly, we are delighted to be joined by Dr. Adrianna Nava. Her experience began as leading the Illinois Hispanic Nurses Association, but now she's the president of the National Association of Hispanic Nurses. The Illinois Hispanic Nurses Association started as a small nonprofit focused on Hispanic nurse leaders, and she entered this position as a novice millennial and grew the organization to the 5th largest in the country by 2013. Her experience was instrumental in redirecting clinical nurses to one focused on healthcare leadership and policy. And I have learned so much from these people already in just preparing this panel that I can't tell you how much it means to me that we'll be able to share some of their experiences today. Her career goal is to create a pathway for leadership in nurses focused on Hispanic nurses and shape the direction of nursing education to build rigor and visibility in healthcare services research conducted by nurses. So I can't tell you how much it means to me to be able to facilitate this panel and how grateful I am to these panelists and to you, everyone on this call, for joining us today in this effort. We hope this kicks off a year of activism. We wanted to start with just some general questions for the panel, and we've reserved quite a large piece of this at the end for Q&A, but we'd also like to ask you and invite you to use the chat box. Rachel will help me to monitor that, and we'll give people an opportunity then to introduce themselves as they introduce their questions. So I thank you again for joining, and we are thrilled to begin. So maybe I'll start, Adrianna, with you. What do you see as the role of policy in the health of our nation?
Great, thank you so much, and excited to be here with my fellow panelists and to see all the wonderful nurses here and chiming in the chat. So policy, as we know, is really important to setting the stage for healthcare and how it's to be delivered in the United States, especially at the national level. And as we've seen, especially now through COVID, that there's health disparities or variations in care, and it's pretty common and dependent on socioeconomic status and as well as racial and ethnic differences in populations that we serve. So national policy can really help us close the gaps and improve the quality of care that is delivered throughout the United States and not just in specific areas. It may not fix all the issues, but it can really help large segments of the population at one time. And for example, the Patient Affordable Care Act in 2010 was passed, and it was instrumental to providing healthcare options for insurance for individuals living within lower income groups. And this was usually between 100 and 400% of the federal poverty level. And this was really important to increase access to care for many Americans across the US. And in the current administration, there's continued efforts to not only increase access to care, but to make sure that it's affordable. And I'm happy to share that as an organization, the National Association of Hispanic Nurses, we recently partnered with the Department of Health and Human Services to encourage Latinos and other underserved communities to enroll in affordable healthcare through healthcare.gov. So you'll probably be hearing more about that in the next couple of weeks because we're really excited about this partnership.
That's amazing. Thank you so much. And Ashley, maybe I can ask you the same question about policy and healthcare and the health of our nation.
Yeah, I think Adrianna said it so well. And maybe just slicing it a little bit closer to each of our own community levels. A lot of the work that I do happens in state-based policy. So, you know, there's a framework of policy up at the national level and then at the state level also. And so much of the way healthcare is delivered is framed by state level laws. So there's just a tremendous opportunity, I think, for nurses to tune in, engage, use their voice, and translate some of the knowledge and perspectives that they have from their clinical practice or from their lived experience in their communities to then start engaging with policymakers around really important decisions that will directly impact their communities and the way that healthcare is delivered and the way that community members have access or don't have access to the care and services that they need. And there's so many different components to that. But I just think there's like, an unignorable link there, which is why the work, Liz, that you're leading, and that's really the forefront of this conference, is there's just a tremendous opportunity for us to lean in, to act, get more active, and try to move the health of the nation forward by influencing policy.
I love that. And Alex, I know you have been instrumental in connecting nurses to policymakers to make their voices heard. So maybe you could talk a little bit about that at the individual level.
Absolutely. So one, I'd like to echo what's already been said. I mean, in terms of connecting policy and the health of our nation, everything right now in the legislative and regulatory environment, both at the federal level and at the state level, actually now that I think about it, even at the local level, is driven through COVID. It is the driving force for all legislative issues in healthcare. Talk about laws and finance and coverage and reimbursement and scope of practice for nurses. All of these are policy issues, and they're obviously central to healthcare and patient-centered care. I often remind ONS's 40,000 members that you probably think this is about healthcare when we're talking about this. It's not about healthcare, it's about money. And budgets are political documents. And so you're allocating funds at the federal level and at the state level through political lenses. And that's how you decide where the money will be spent and on whom and reimbursed to whom. Think about providers that way. And so policy, politics, and people, which would be the reason for nurses to be much more engaged in the process, because it is not just a one-to-one. I like to say that I speak in cliches. This is a marathon. It's not a sprint. So being engaged in the process, getting your colleagues, your peers, and your patients to be registered to vote wherever you are on the ideological spectrum is essential to being involved in changing the system. And so it's imperative that nurses jump into this and don't say things like, well, I'm just a nurse and no one wants to hear from me. And, I'm just going to do what my hospital or practice or facility wants me to do. No, I like to say that nurses are, and I am not a clinician, nurses are advocates by personality as well as profession. You got into this because of who you are, and you're not afraid to speak truth to power. And that's the essential part of this. You can make a difference. It's hard work, but it takes some time. But being involved in policy has a direct impact on the allocation of healthcare for the nation.
Liz, can I chime in?
Yes, please. Please do. Please do.
We're going to misbehave and all kind of talk together. But it is really fun to have the chance to all be together for a conversation. And Alec, I think you just hit on some really important things. One is I work with nurses. A lot of them are in formal leadership roles. And it surprises me that some of them still feel as intimidated as they do to engage in conversations with policy decision makers. And I'll try to remind them, like, they are just people, right? These are people whose work happens to be in policy, but, they live in your communities. They are just people. And for these leaders and for all of you, right, who are leaders in your own space, just recognizing that you are very well equipped to have a thoughtful conversation with all of them, and how meaningful that is. And I also think it's really important to remember, like you said, this is a marathon. This is not something that is usually solved very quickly. So, for example, in Massachusetts, we worked for a really long time on addressing scope of practice for nurse practitioners, right? And it was not for a lack of data, right? And so for all the scientists here, all of us who are so committed to having strong evidence, this hasn't been a problem with the evidence for years, probably the better parts of decades. It's a political problem. And in order to solve a political problem, you need to engage with the people, right? And so circling back to what Adrianna shared, like I could not be more excited about your collaboration with the federal government around, for the National Hispanic Nurses to be leaning in to have that partnership, right? I think that's one of my core messages here is this policy work is relationship work. And it really is about engaging with key stakeholders, building productive relationships, and then having influence that way.
Yeah, I love that, and I echo that. And I think the more nurses do it, the more we become more comfortable with it. I think there has been, just to kind of expose maybe some of the myths around this, there has been, and there probably continues to be, and I would love to hear from people on this call about whether there's the messaging from the majority of nurses who work in hospitals often will say that they feel like they can't speak out politically because of restrictions from their employer. And so I don't know how we can reflect on or address that as a barrier, whether it's a real barrier or whether it's something, or it's perceived, or it's a combination of both.
I'm happy to say a word or two about that, and then others might chime in. I spent years working at one of the big Boston hospitals, and in my role in the nursing department was to basically have a collaboration strategy with our Office of Government Relations. So this was something that we worked on a lot. And we were clear with nurses, like, you can speak on behalf of yourself anytime, uninhibited, right? But if you are going to speak on behalf of the organization that you work for, you do need to have sort of their sign of approval, right? So I can go and say, Ashley Waddell, as a constituent in this area who's been a nurse for this many years, this is my background, here's what I think, here's what I'm asking you to do. And that would be really different than me saying, I'm a senior nurse leader at this organization, and I'm here on behalf of the organization to encourage you to make this decision. So I think some of it is just asking the question of, how do I identify myself? And it's not wrong to do it in one way or another, but I do think it's an important point of awareness. And then, obviously, if you're not speaking on behalf of your organization, you can still have internal conversations with them to try to nudge them closer to seeing it as an asset that you would like to represent them in conversations.
And I'll ask one more question of the panel, and then maybe we'll open it up to others. So nurses being the most trusted profession and also 4.5 million strong in the United States, how can we be engaged with and somebody said this in the prep session, Alex, maybe it was you, how can we become the people that that political people go to for an opinion or for a perspective, or for to run things by, and also lastly, how can we encourage, since the nature of this conference is voting registration and using the power that we have, how can we engage in that process, and how can we engage our patients? But Alex, I'll turn that, I had heard in the prep session something about that, so let me turn it to you.
So great questions. I totally agree with what Ashley said. And let me say this, you nurses, this actually applies to everybody, but when we're talking here about nurses, you have a literal constitutional right to redress, quote unquote, redress the government. That is literally written in the Constitution. So don't say, well, maybe it's not our place as nurses, or maybe I shouldn't do that. As a citizen of the United States, you have a right, a constitutional right to redress your government. I don't care if you want a stop sign at the end of your street, or you want to talk about scope of practice and vaccination, okay? That is your right as an individual in a participatory democracy. That's what we're doing here. And so you shouldn't be afraid. Or maybe you have some trepidations, or maybe you have some fears. It's a realm that you say, look, I'm working in the health and medical field, and this is different. I get that. It is designed also politically to be intimidating. It's much easier for politicians in the government to say no that it is to say yes, because yes means we have to figure out how we're going to do that. No means, thank you, came in, we can't do it, we don't have the money, it's not the right time, fine. I work for ONS, I have 40,000 members. We represent the interests of 110,000 US oncology nurses. I assure you that every nursing group out there, there may be some very small ones, but every nursing group out there has professional staff who do what I do. They track legislation, they try to build relationships, they weigh in on issues. And by the way, the issues are no longer just nursing issues, or they're not perceived just as having the word nurse in it. There's racism, and there's telehealth, and there's food insecurity that I would say 2 years ago, people say, well, those aren't really nursing issues. Yes, they are, because they're patient issues, they're access and affordability issues. And so the nurse, the role of the nurse, as Liz just said, as the most trusted profession, not the most trusted healthcare, but the most trusted profession for 2 decades. You fell in 2001 to firefighters after 9/11. But since that time, nurses overwhelmingly, public opinion polling shows far and away. And in fact, last year, the trust level from the American people for nurses went up 5 points, from 85 to 89% approval rating. Because of COVID, everyone knows you're on the front lines. Just to put that in perspective, physicians, they're at like 70 some odd percent. Clergy, teachers, don't even get me started on members of Congress. Celeste Williams, who ran for Congress in Arkansas, okay, whose t-shirt I wear frequently, all right? If you want to know how you can do something, I'll tell you right now, put your name on a ballot. That's how you can do it. It doesn't have to be, as Celeste did, for Congress. It could be for city council. Work with your organization, your nurse specialty organization, or the ANA. They are dying for volunteers. And if you want to do something for nurses at the 40,000 level with the ANA, or if you want to do something for the oncology nurses, there are staff there to help you do that, regardless of your ideology, to help move that message along. And members of Congress are eager to hear from you. They may have their staff talk to you, but in the old days, 2 years ago, when you can go out for coffee, you call a state representative or a state senator, you can meet them at Starbucks for an hour to talk about the issues. Hi, I'm a nurse, and this is what's important to me. Nurse ratio, scope of practice, any kind of specific issue, and you'll find your words will be echoed on the floor of the state legislature, because they've never spoken to a nurse and had those conversations. And then you'll end up having all sorts of issues and conversations, and being what you are, which is that most trusted resource, which is what we're trying to do. As I said before, it's a marathon, not a sprint. Policy, good policy takes effect through incremental aspects. I'll climb down off my soapbox in a second and end with this, that Ted Kennedy, senator from Massachusetts, said, President Nixon came to him in 71 and said, let's expand healthcare for more people. And Kennedy said, if we're not going to do universal healthcare for everybody, I don't want to do it. In 2008, he said he was wrong. Had he taken Nixon's idea and said, okay, let's include children to age 18, and let's make it not 70, but 65. By the course of that 30 years, he said, we would have closed the gap. And by 2000s, in those 30, we would have covered everybody, because incrementalism is how good legislation moves forward. And the role of the nurse, the voice of the nurse, in exactly what Ashley said, not for a lack of evidence, would change public policy, which was your first question. It makes it all intertwines. And let me put a plug in for ER vote, which is that if you're not voting, or worse, if you're not even a registered voter, then you don't matter in the system, because you have no impact on elected officials. They can dismiss you out of hand because there's nothing you can do to change things. You're not voting, you're not even registered to vote. So they don't care about you, they care about constituents who are there to vote. they'll take your call. You live at 123 Main Street and you're going to call your state senator or your member of Congress. They're going to take that call if you're someone who's on the list who votes all the time. So that's imperative.
Thank you very much. And we'll help you down off the soapbox, but we really do appreciate it. Adrianna, let me turn to you to talk about a little bit about some practical examples, and then let's open it up. If people want to speak and they can put their name in the chat, that would be wonderful. And we'll use the chat box as a cue.
So for myself, being with the National Association of Hispanic Nurses, it was actually like a longer trajectory to get here. I remember when I was first a new grad and started in the ICU, I knew about health policy because I was actually able to work in Congress as a legislative intern. And that's when I was first exposed to health policy, because back at that time, nursing curriculum didn't necessarily have health policy integrated into it. So I'm like, wow, health policy, what is this? And I'm working, with the congressman and really excited. And when I went back home to Chicago, where I'm from, I was like, well, what next? I have a BSN, I'm working as an ICU nurse, and I want to do health policy. I'm really interested, but I'm not at the point where I want to, quit nursing and go into maybe a legislative staffer or some other, nonprofit. So I continued to work as a nurse at the bedside and then decided to go back to school. So then I got a lot of school, which ended up with a master's, an MPA, and then a PhD in health policy, but really looking at the research side and learning analytical skills to do data analysis from policy perspective was really important to seeing, wow, like putting numbers to the disparities, and then how do I translate that so people actually know about it? And then that's what pushed me to move into the president role of NON and run for that. And even going back to voting, even if it's in an organization and having members vote for individuals, that's very important because you want them to have the vision to move the organization forward. And a lot of members don't know that because even voting within organizations is very low. And participation in running for those positions is pretty low sometimes too, at least for our organization that is a little bit smaller compared to ANA. But as we move forward, just getting nurses interested in being informed and being able to see why it's important to learn about health policy and getting the skills, whether it's through education or whether it's by working in their community and being able to network. And a lot of these skills that I learned from leadership skills that are the soft skills of networking, communication, was working in the community. So I think that really translates well when you want to work in health policy in general.
Great. We'd love to open it up if people have questions. And I have a list of questions, but we also want to hear from people here. So maybe while people are thinking about some additional, well, let me pause for a minute and just see if if people want to weigh in. Celeste, I feel that you were about to take yourself off mute because I've been teaching on Zoom for a year and a half, and now I know all the secrets.
Well, I wasn't, but I'll take this shout out. I do think it's really, I think I live in a state where we are 50th in voter participation, and we lead the nation in most negative health outcomes. So I'm certain that is no coincidence. And I'm just curious if there is any data out on how civically engaged as a whole nurses are. Because I think it's such an important group to get involved and get active, and we are trusted, and we do have amazing perspectives and life experience, and we see the impacts of our current policy. So I'll quit talking and listen.
So, I'll take a first stab at that, just because this is the basis of, I started this organization, Nurses Who Vote, because I teach at Hunter Bellevue School of Nursing in the doctoral program, and I was teaching the doctoral level health policy class, and right before and then during the prior administration, and everything in the book was wrong and bad, and the systems, we couldn't get our arms around anything, and I threw the textbook away, and my class and I, 3 years ago, that policy class and I started Nurses Who Vote, because, Celeste, when I looked at the data, nurses were not voting. We have always said if nurses voted as a block, we could change the election. And although the organization is nonpartisan, when you use health as a lens, things like climate change, poverty, all those things, food insecurity, all those things become the sides, become clearer, but it's really about the health of our nation. So we threw away the textbook and we started working with the League of Women Voters in New York City to first register. To your point, first we decided to register nurses to vote. So we did that for a while. I met Alec at a conference where we were tabling. Nurses Who Vote was tabling to register nurses. And then we started working with nurses to register their friends and family and finally their patients. So we are seeing both the effect now in New York of working with nurses and then them working through, and we actually developed a plug and play curriculum that I sent out nationally to one, in the semester course for health policy. It's just one session on the power of nurses and voting, that it's plug and play into the health policy class, and it comes with a voting kit. And and we sent out about 400 of them right before this election that we just had, the one that Biden won. So it has been a journey of asking that exact question, Celeste, to your point. And maybe Adrianna or Ashley or others, if you have experience and want to respond to that, I'd love to hear more about people's experience with that.
So a bulk of the work that I did in my PhD program focused around this. So looking at the concept wasn't necessarily like civic engagement, but it was participation in policy at multiple levels. So looking at like within organizations, so, that might be clinical work, all of it is policy driven, right? Whether it's medication administration, blood transfusion, stuff like that. So there's opportunities to participate in policy within organizations that employ nurses, in professional organizations, as Adrianna said, the Oncology Nurses, my organization, most nursing organizations will issue policy positions or sort of guidance around policy topics that then can be used by advocates to have conversations to inform either other voters or elected officials. And then there's a lot of ways civically to be engaged. So voting, but I would also say leadership roles on community boards. During the pandemic, I kind of connected myself with a lot of youth sports organizations who seemed to really be floundering without someone with a healthcare background who could help them sort of navigate working with the local board of health around, exposures, return to play, basically, the protocols that were implemented to help stop the spread. So I became really involved with youth sports organizations, and then through the local collaboration with like local school nurses around pool testing and trying to help schools be healthy enough to get kids back in school. And, to me, that's not, it's different than voting, right? But it's really the piece around engagement. And that's why I say, like, if you want to talk to me about becoming more involved in policy, you don't have to go to the State House. You don't have to go, to Congress. There's so many ways to do it because it's about conversations, and it can be conversations with the school board. It can be conversations with local leaders. And, I'll kind of end by saying we had a new representative in my district, and I had a meeting with him, and we were going through some of the different policy priorities that, were important to me. And he was like, listen, tell me more about this. And he's like, Ashley, I'm a lawyer. Like, what do you think I know about this? Right? Like, I don't know anything about this. And I'm like, well, fair enough, right? I don't really know anything about being a lawyer. So like, we can all own our space and then talk to each other as equals. And I think Alec pointed this out, that it's so easy to sort of perceive ourselves as not belonging in those conversations or not belonging in those spaces. But we do, because we understand health from a really, really important perspective. So I'm kind of the mindset that like there's so many pathways to participate, and that if we all just sort of commit to one or two, I really think we can make great forward progress. And I'll end, Celeste, by saying that the culmination of my doctoral work was a valid and reliable tool to assess health policy participation. And so the work was really done all around the psychometrics. So we have not done any sort of large scale assessment, but I share the perception with you, or the idea that it would be really nice to sort of have benchmarks, because I do think you could then make correlates to the health of communities if we had a sense of like how engaged nurses were, you know, by state, by region, by practice area. You could slice it really however you wanted to.
This has been, oh, sorry, go ahead.
Oh, no, I just wanted to add on to what Ashley was saying about engagement, but you know, most nurses are at the RN level, and I did notice many people reference their doctoral work here in this talk, and I just realized, like, even I, as a first-year PhD student now, this is when I'm becoming most aware of health policy and how it really trickles down to the bedside nurse. And most recently, even though I'm a nurse practitioner, I worked a bit as a bedside nurse and realized that the frustrations at the bedside are really what are preventing people from wanting to engage, which is unfortunately counterintuitive, right? You would think, I have so many frustrations at the bedside, staffing and pay and, you know, all the COVID, and unfortunately that wears people down and they don't want to be engaged. And then, you know, very few of us get PhDs. And so only 1% of us are really, really passionate about these things. So we have to have a way to reach the bedside nurses, to engage them, to say, well, you know, you either continue to work and function in the way that you have and let the corporations have the power, or we take it back together, you know, or we take it at all. I don't think we've ever had it.
Yeah.
Such a good point. And Adrianna, I feel like you can probably speak to this, but really all of us, you know, so the three of us all work for professional nursing organizations. And I think one of the things to help people find a home there, that, you know, it is a really good way to be connected with advancing your profession. And it doesn't matter if you want to identify, you know, yourself in any sort of different way. There are a lot of professional nursing organizations that are sort of equipped, I think, to help nurses have a voice and to try to have some control over practice. But I totally hear you that, you know, the work environment and, you know, people's level of engagement and exhaustion, it's understandable how it's a little bit of a struggle.
Can I just add this, that no other healthcare professions have issues advocating on behalf of their own practices. You never hear, and I used to advocate for many physician organizations as their lobbyists. I'll say the nasty L word, as their lobbyist in Washington, and they don't go in and say, I'm doing this medical specialty group, don't forget the nurses. They don't ever say that. But every time I take a nurse into a congressional office, they say, and don't forget the physician and the hospital and the patient. Oh, and the drugs are very important. You know, nurses need to own the space, as Ashley said, and be involved in that. And of course, we're about coordinated care. I get that. But you also have to speak up for yourself. And it doesn't mean that you have to be a professional advocate and it has to be all consuming. But there could be something that's really important to you that you can get your peers and colleagues and friends in the hospital, in the practice, on the floor, together to do something maybe once a year. And these days, everything is virtual. Send an email. That's far better than doing nothing at all. You can make those connections.
I'm gonna actually pull up one of the questions from the chat. And if it's okay, I have on my cue sheet that we need to wrap up at 12:40, but do we have 5 more minutes, Rachel?
Yeah, we can go till 12:45.
Oh, that's great. So one of the questions in the chat, and I think it's a good one, is for people who are working in hospitals with nurses on the floor, it looks like the Vot-ER is thinking about the best ways to get those floor nurses activated to help people vote, and think about like democracy at discharge, or the right time, when floor nurses could be inviting people to register to vote. For people who are on day one, who attended the day one, there's like a QR code scan. You can wear like a lanyard with a QR code scan that can help people register. You can talk about registration. And because nurses do a majority of the discharging of patients, the longer discharge, the more involved instructional discharge, is that a time, or is there a different time when nurses could be involved in registering, educating patients about voting?
I think I'm having a hard time with this question. It's a great question. I am glad we're having this discussion. Just going back to Brenda's point about the frontline nurses and trying to get them involved. In my current role, like paid role, I run the quality department for a facility, and we're always looking to nurses to, do quality improvement, improve our metrics. Our organizations are very metric based and outcomes based, that to add like now this like health policy workload to them. I mean, I would love to continue this conversation, because I think, what do we expect for the frontline nurse? I know we want them to be engaged in health policy. We want them to improve quality. We want them to do all these things. But how does that happen when a lot of them are leaving the bedside to go back to school, become nurse practitioners, and just get away from the bedside?
I think having been spent much of my career in the hospital, if I was going to, the question which is in the chat has to do with like it's both about voting, but about a little bit about the power structure of like charge nurses and their staff. And I would say for that one, there's power in numbers. So if a whole floor did it at the same time, that would probably provide the relief that people might need. A second thing is that I think our lessons learned from our voting campaigns were that this is a hard discussion to have until you start. It can be a hard discussion to have. So getting started having that discussion can relieve some of the worry about how will this kind of go over with the patients. I do see that it's 12:45. I want to thank the panelists so much. Please watch for a follow-up publication from this panel asking this question, and hopefully we will be able to return it to the people who attended this session. We thank you for your input, and we really appreciate everybody joining us for this, and I especially appreciate the panel. So thank you so much to everyone, and thank you, Rachel, for your help.
Thank you, Liz, so much. Thank you to all of our panelists. I just put a link in the chat to return to the main session. We'll have a break, but there'll be some activity in the main room during the break, and then we hope you'll all join us for our next session starting at 1:15. Thank you, everyone, and we'll see you for the next panel.